Fertility and pregnancy in traditional East Asian medicine are considered a natural function. So, like any disease name or disease presentation, there is no single herb or formula structure that should be used just for infertility and pregnancy. Todo Yoshimasu emphasized that pregnancy, because it's a natural state, you need to understand what is inhibiting this natural function. And you are not just to prescribe fertility herbs for patients that come in for your help. He was taught by a main student of his father in gynecology and other specialty realms, and he always had trouble with this position that they had where there was different disciplines, so there was different specialists, because when you're starting to see very specific patients all the time, so if you have a clinic or you only treat fertility patterns, then you are not considering formula structures, you're considering herbs and patterns according to what you're used to, and you're not looking at this patient afresh, where you'll come to your own conclusions before you almost already see them. So if somebody's old, you use this herb. If someone has period pain or clotting, you use these herbs. It's very important that you understand the mechanism of the body, what function is inhibited, why the body is presenting in this way. And that is why he had trouble with these different disciplines, because you'll start to have these go-to formula structures. And it's important that when somebody approaches you in a clinic, you look at them from a blank state. You have to start from the beginning and work out structures and patterns, because this impression that certain herbs are better for fertility, it's widespread, and it's very obvious to me using this ancient systematic evidence-based approach, treating hundreds of infertility cases, that regardless of the herbs and the formula structure, if you correctly identify this pattern, the outcomes are always positive. Todo Yoshimasu, he was saying that he caused widespread disgust at him in Japan, or across Japan, because he was very famous at that time, and he gave a herb to this infertility patient, and it was called Shi Gao, Gypsum, and in TCM it's a cold herb, and he was explaining that her presentation required this herb, and this is a very specific formula structure, because Shi Gao always presents with this large thirst and vexation and agitation. If it goes on long enough, you always get this large abdominal distension. So when you can identify the herbs correctly and work out the formula structures according to these connections of primary and secondary indications in the abdominal, the formula is always correct. But it caused a large controversy in Japan, and he was trying to explain why he was using it, but in the end, after like 3 to 6 months, she was pregnant. And there are numerous examples where I've used these formula structures that are not considered fertility formulas. Just a few months ago, we had this middle-aged lady that came in for infertility, and with infertility, her major primary indications was that she had this chronic watery loose bowels, and it was going on for years. She had extreme abdominal pain, vexation, agitation, insomnia, aversion to cold, and when we checked her abdominal, we found this non-responsive sphere shape in the upper epigastrium, which indicated a herb called Ren Shan. And then we're coming through her abdominal, we found that on her lower quadrum on the right side, it was responsive. It's like a position on the abdominal becomes responsive and painful. And when you press on it, you get descending pain into the lower of the back or the genitals. It indicates a herb called Dangwei Angelica root. And then from there, we worked out each individual herb. But the main thing with that presentation was the fact that she had these small worm-shaped objects in the upper epigastrium, and it always indicates a herb called Wulme. And when we prescribed that formula prescription, after a week, she was having bowel motions with these white stringy objects. And then after that, the following week, all her abdominal pain and diarrhea resolved, and then the vexation and anxiety, insomnia disappeared. Everything resolved in that 1 to 2 week period. And then following her period, the next month she was pregnant. And then in the last year, I've used formula structures, Sini-san, which is a 4-herb formula structure, a formula called Chahugweita Ganjang Tang, a formula called Jitsa Gansao Tang. I've used a formula called Zhao Shenchi Tang, which is considered a purging decoction. So just these 4 formula groups, they're not considered fertility herbs, but when you have these first 2 formula structures with a herb called Chahu, it always presents with this locking up under the diaphragm, so the ribs and costals all lock up, so it's very responsive and uncomfortable. And it's coming back to understanding that when the heart pumps the blood, 25% of that blood moves into the small intestine. So when the heart blood pumps through into the small intestine, we consider the small intestine, basically it always sits near 40 degrees. So it's like 37 degrees. And it's this warmth that is very important because it's its warming function that warms all the blood and body fluids in that lower pelvis. In TCM, they call it kidney yang or Ming Men. It just means the place in which warmth moves through. So when fluids cool down, it means they'll become turbid and thick. And if it moves into the blood depth, the blood congeals and hardens. So it causes a lot of obstructions in through that lower pelvis if that relationship between the heart and small intestine is infected. So when you have this Chihu formula structure, it can cause a contraction under the diaphragm, which causes a locking up, which inhibits the movement of warm blood into that small intestine. For the next formula with Gypsum in it, and Gypsum would never be considered for fertility. And Gypsum has these primary indications that I've discussed before with this fluorescent yellow tongue coating, engorged blood vessels beneath the eye, yellow urination, sticky yellow stools, but it always has this locking up upright chevron in the upper epigastrium. And what that does, it inhibits the movement of warm blood into the small intestine. And the other formula structure is our shenchi tongue, which has a herb called Huang, rhubarb root in it. And that always presents with this responsive fullness, this discomfort in the upper epigastrium, and that can inhibit the movement of warm blood into the small intestine. So when we are explaining restoring natural function, we are identifying these objects, these obstructions. What is inhibiting the movement of warm blood into the small intestine? Why is that lower pelvis congealing and becoming obstructed? It's understanding and restoring this natural function. And that's why it's important that you don't have these go-to herbs and formula structures for fertility. You look at this from a blank state and you work it out. Why is this formula structure required? What are the presentations? What are the primary indications? What color is the tongue coating? And check the abdominal. The abdominal is very important to identify obstructions. Obstructions just means that there is shapes or fullness or that there's water sitting there. Understand where the obstruction is, resolve that by restoring natural function, and then everything comes back into harmony again. And that is when fertility, when pregnancy happens by itself. And it is true that certain herbs that people consider fertility herbs, they are quite common. So a lot of the times they are there, but they must be identified. Herbs like peony root, baishao. So it's a very common herb that is used in fertility formulas, and the reason why is because baishao always presents with these responsive tight rectus in the lower abdominal, so everything starts to contract and lock. But with this contract and locking, it's the same mechanism. It can be cause what they call a Sydney pattern, where it actually inhibits the movement of warm blood into the small intestine, or it can be a taxation pattern, where the body starts to dry and harden, and it leads to basically everything to dry and harden into the lower pelvis, and that's when baishao is indicated. A herb called mudampi. So mudampi is quite often used if there's like secondary indications like endometriosis or like thick clots. Like this herb is identified according to these inflamed ovaries, especially on the right side again. So when you're checking the abdominal, it feels like this inflamed golf ball, and that's very responsive. So with pressure, that pain radiates down the back, the lower leg, or into the groin. So each herb can be identified, and they need to be identified before you include them. So you don't just add them in. You don't just say, this is a great fertility herb for this pattern that has heavy bleeding or clotting or period pain. You understand the structures of the herb, and then you come to these structures in your formula. So you put them together to make these formula prescriptions. Todo Yoshimasu stated that the role of a medical doctor, a herbalist in these cases, is to clear the obstruction and to restore this natural function. If there is still an inability to conceive, then this is a heavenly matter that we as herbalists or medical doctors, we cannot influence. And what that means is that when we have somebody that comes into the clinic and we resolve the obstruction and everything comes back to normal, and it is a waiting game. And if there is still an inability to conceive, then we cannot influence those matters. It's happened to me maybe twice in 10 years, though. There was two patterns, two different presentations, one including this herb called mudampi with the inflammation in that ovary. She came in with very painful periods, large clots, heavy bleeding. There was also a lot of anxiety and palpitations. And then when we checked her abdominal, we did in fact confirm there was inflammation in through the ovaries. Just lateral to that, down the rectus, there is this tight responsive discomfort, which indicates a herb called taurin. When we checked her abdominal, there was pulsations to the xiphoid process, which indicates a herb called Gypsum, with splashing under the diaphragm, which indicated the herb called Huang, and then we gathered the formula structure called Gypsum Huang. And then when we prescribed that, she eliminated a large clot, and then all the pain and discomfort and heavy bleeding, they all resolved in, I think, 2 cycles, and then all the anxiety and palpitations resolved. And when we checked her abdominal as well, there was no more splashing, no more pulsations. The abdominal was nice and soft and warm. And then it is the weighting game, because again, remember, fertility is a natural function. But in both examples, with this presentation that resolved, they still could not fall pregnant. And this is something that what we call a predetermined infertility case, and we can't influence this anymore, and it can happen. But the only way to separate these presentations are these ancient formula structures, because the herbs are measured and dosed in a relationship that are very specific for these obstructions to restore natural function. And this is what separates these predetermined and non-predetermined fertility cases.